This is Let's Talk Business with your host, Marc Ebinger. Now, here's Mark.
Welcome back to the Let's Talk Business podcast. Coming up on the show today, we're going to talk about membership-based direct primary care practices where patients pay a monthly or annual membership for access to their primary care physician. Kind of an interesting idea, but I have so many questions, Doc. In studio with us today is Dr. Manuel Vogt, a family medicine physician with San Antonio Direct Primary Care. Dr. Vogt is a board-certified family medicine physician. I don't know why. It's like so many big words here. I'm not used to saying them.
You did better in the practice,
right? Right. But he's got over a decade experience and is focused on revolutionizing healthcare through personalized membership-based medicine. Dr. Vogt, welcome to the show.
Thank you for having me.
See, I learned, because I started this show on radio. It was 27 minutes. You started, you finished. There were no retakes kind of a thing. So it's like we just kind of roll with it. I'm your host, Marc Ebinger, the CEO of Krukus Virtual Staffing, a company that recruits and staffs experienced overseas administrative assistants for insurance agents and attorneys. See, I didn't mess that up. I've practiced it a few times. If you're curious about the most common tasks that virtual assistants are doing for businesses, head over to our website at krukus.com and grab a list of the top 20 tasks that VAs are doing for businesses like yours. The link is in the podcast description now. Lots of people pre-record that and stick it in the podcast. I've heard live every single time.
I agree, because then it sounds sounds the same every single time that I think people tune out. So that's why it's better that you record it each time.
They hit that forward 30 seconds thing, you know what I mean?
Mm-hmm. Well, me and Howie do it differently every single time.
You guys
so
do?
You never can skip ours. My name is Heather Boehme. I am a certified business coach and owner of Onset Professional Development. We focus on process mapping and optimization to help business owners delegate, train new staff, and grow their business, because life is too short to feel trapped by your business.
The queen of mapping.
Yes, the queen of mapping. I was trying to explain to somebody what you did the other day, and I said I couldn't remember the word. I couldn't remember that was mapping.
So it's like a diagram of your business.
Right.
And at least in my layman's terms, that's how I would conceptualize that.
I ended up describing it as managing the processes of your business so you can be more efficient and more effective.
That doesn't make any sense. I like the map.
That doesn't make any sense. Well, see, they had like career day at my kid's school. She's 4. I don't know why we're doing that right now, but they were like, do you want to come? And I was like, I can barely explain what I do to human adults. 4-year-olds would not be charmed, but my husband brought in a giant like traffic light, and they played green light, red light, and that went over super well with 4-year-olds. So
and
not
he's
as
an
interesting.
Engineer, and he's relating to kids.
Yeah.
Correct.
That's great.
Yeah. Civil engineer.
Yeah.
Red light, green light. They love it.
But entrepreneurs, we can't relate to kids.
Process mapping, not really a 4-year-old
Process mapping,
thing.
I'm going to write it down.
The process of bedtime is you brush your teeth, then we read the story, and then we go to sleep.
You're like hardcore mom, aren't you? Aren't you?
Oh, you mean like structure? Oh, heck yeah. They thrive in structure. They are insane. They're like tiny drunk sorority girls. I need them to go to bed at a certain time, and you know what? They like it. Mm-hmm. They don't want to. They fight it, but you know what? They thrive in structure, and so do entrepreneurs. They don't like it. They're just like babies and children. But when the right structure is in place, they're well rested, and they know what's going on, and they can focus on the things that they want to do. And they're not insane about it.
This is how she thinks of it.
Right. Yeah.
I'm like a drunk sorority girl now.
Well, you don't quit. You're not
yeah.
laying on the ground screaming because I wouldn't get you cookies at the store. So that's good. But it's very similar. Entrepreneurs are visionary style people who don't want to follow society norm rules, right? You don't want to follow the structure of society.
We don't want to. It's just that we don't see it's wrong. We don't
It's
see
wrong.
the benefit.
Yeah, my toddler thinks so too. She thinks that you can just undress in the middle of church, and that's super cool and okay. And I have to provide the structure of that's not okay.
Yeah, well, if you want to know how not to raise kids, come and see my 3 teenagers in action. When one of mine was the ages of yours, I had told them that if we were outside somewhere, at my friend's ranch or in my backyard, he can pee outside. So we were at Costco getting gas. There were 6 or 8 lanes of cars facing in one direction, and he got out, walked out, and peed in front of everybody.
Like in the bushes? Did he think he was in the wild?
He was going towards the bushes, didn't make it.
Good.
So he just stood there at the end of the parking lot and did it.
In some places, that's a crime.
Yeah, that's right.
He's arrested for
France, it's
public
not.
urination.
Well, Howie,
And
do you want to introduce yourself?
yeah, what do you do,
And
Howie?
I'm Howie Nestel. I am not a certified anything, but I do own an advertising agency, so it qualifies me to talk about marketing because for the last 30 years, I've recognized that businesses struggle with marketing. And so we've developed ways to help our clients become more effective in how they communicate their message to their target audience. As a result, I'm happy to say that most of our 450 clients are doing better than their competitors.
Not all of them. Some of them are in transition.
Some of them don't listen.
Well, I was talking to somebody about Howie's services today, and like Google Analytics and SEO, it's a very like you need to read the manual and follow the instructions type of thing. And I am a very skim the manual and figure it out while I'm doing it kind of thing. And they don't go together very well.
There are certain things that you can definitely, as I call it, stitch the parachute on the way down. Certain things you don't want to do that with because the consequences are pretty bad. We've had clients get delisted on Google where Google shows them as permanently closed because they went in to try to manage their own Google My Business account. And they made some changes that caused big problems. We've had a client that owned 2 different businesses, so he hired us for one. We did all his web listings and search engine optimization. All that was going fine. He opened another business. He happened to use the same office, so he put the same address on Google with a different business name, verified it himself because he wanted to save a few $100, and then they deactivated both of his accounts. And he had close to, I think, 700 or 800 reviews in the original business.
Did he lose all those reviews
He
permanently?
lost them. He lost them. He lost them permanently long enough to where he could no longer pay us for marketing. So I don't know whatever happened after that.
Oh, so
because
he really went in the wrong direction.
yeah, he
there.
really went in the wrong direction. And he called us in a panic mode. But again, this was something he had done. And he says, yes, I was trying to save some money. I did it on my own. So that's a DIY story gone really badly.
Yikes. All right. A quick reminder to follow the Let's Talk Business podcast on all major podcast platforms. You can get to everything easily by going to our website at satalkradio.com. All right, Doc. So give us a little bit about your background and what led you into the business of this direct primary care now.
DPC.
Yeah.
Yeah, so I trained in Brooklyn, New York at NYU Lutheran, where I met my wife, who's actually from San Antonio. Previously an engineer, then turned doctor. Lots of school debt, as you can imagine with
Right.
that. And when we were there, we were kind of exploring, what options are there besides non-traditional, health insurance-based medicine. So we stumbled across a direct primary care summit kind of meeting, I think in Kansas at the time. So we flew out there, it was very small at the time, and we said, we love this concept of not billing insurance, just charging a flat monthly rate and seeing your doctor however much you want. So fast forward a little bit, we graduated residency, again, a lot of student loans. So ended up still going into the insurance-based business for a few years until we could mostly pay off our student loans. And then we opened up our DPC practices. So my wife opened up hers in 2022. I opened mine August 23 is when I opened up.
How do you get all the access you need to a doctor and only pay a flat monthly fee? How does that even work?
Well, our overhead went down significantly when we changed models because we don't have to hire a biller and coder. We don't have a clearinghouse. The computer system we use is a lot less complex because we're not coding like we used to capture things. So our overhead dropped like crazy. That is then passed along to our patients.
So isn't that kind of the death sentence for insurance agencies in some respect? Do you think it could be a huge problem that insurance agencies are going to face, or insurance companies or healthcare providers or ultimately wherever that money is aggregated and then distributed, they could be out of a job if enough of these direct
primary care clinics open up.
Yes.
So it's definitely, that's on their radar. I mean, there's no way we're not. It's grown so quickly, the whole movement, even now encompassing specialists. So there's something called direct specialty care. So we have like endocrinologists, neurologists, pain management that's doing it now. where everybody's just tired and fed up with insurance companies.
Is that your goal, really, to put those folks out of business? Or is that really just incidental?
It's kind of incidental. You know, it's
So you're not a hitman for the insurance
Oh my
companies?
gosh, I
Well, but
knew
then
I
there's
knew
still-
it was coming
But then
around.
there's still major medical, there's still surgeries, there's still cancer, there's still a whole bunch of things. And if you think about it, if these groups get organized and everybody's paying in a way, it's kind of like insurance. Because I'm sure, Doc, you know, you guys came up with a price, one, that might be what the market could bear, or two, that would make enough profit to cover all the, make enough revenue to cover all of the expenses plus the profit. Correct?
correct.
It's still pooling money because some people are going to use your resources and other people, you're not going to hear from them the whole year, right?
Yep. Mm-hmm.
So, but
That's exactly right.
what are the limitations, right? Somebody breaks their arm, are they coming to you?
Probably not, right? There's, you know, a scope of practice that I stick with, you know, and if I'm uncomfortable with something, then of course I tell them, hey, we need to get a special involved at this point. And we're good friends with a lot of the specialists. We have a very good network that we use. I was texting a urologist right before this on a patient who was going into a procedure. So we stay in very close contact. They know that we have cash pay patients as well, so they'll have cash pay pricing for them.
So what are you covering? What can people expect to come to you and be treated for?
Yeah, so when they come into our office, we'll do, of course, annual physical exams. I treat high blood pressure, diabetes, cholesterol. We do weight loss management. We do some testosterone. We do, you know, common colds, all that stuff, allergies. I do arthritis, so joint injections. I'll do like knees, shoulders. Those are included, by the way. I don't charge extra for that. Versus if you go to a doctor's office, you're going to get stuck paying for the visit plus the injection, which in San Antonio will run around $200 probably, plus the visit fee. In the office, we do EKGs, breathing treatments. So if you're asthmatic, you can come in and get a breathing treatment if you're flaring. We do anti-inflammatory injections, B12 shots. I do diabetic nail trimming, ear cleaning. So there's a
Do
good.
you get the good, like,
Oh, yeah.
cool ear cleaning? I love watching those videos on TikTok.
Oh, yeah.
Have you seen the ear cleaning videos?
No,
Yeah, they're
Life
disgusting.
changing.
I've put one up before.
Ah, really?
But I need that.
Huh?
I need
Well,
that.
here you go. Referral.
You're going to take my joke,
Honestly?
man. So,
I
Doc,
did.
what does it cost, and do you still have any room for new patients? Because there's got to be a point where you max out.
It's varied by clinic to clinic. So I charge now $120 a month with a one-time $100 registration fee, but that was because I'm kind of at a very fine point where I want to be almost with patients. So as somebody drops off, I'll add somebody on typically. So I'm still taking patients. My wife's clinic, she's down in the King William area. She charges $100 a month with a $100 registration fee. She's still got openings. And then we have another branch in the med center called Tailored MD that are also still taking patients, and their price point's also still at about 100.
So I don't want to get away from this because I want to dig into that because the money's interesting to me, right? It's like ultimately that's what fuels the business, right?
Right.
And defines it as successful or not successful. I don't care if you're altruistic or not. You still need money to run your stuff.
Correct.
Why are you looking at me?
Well, I was just watching for facial expressions
Yeah.
over there on what I'm saying. But at any rate, so what is what's your profit margin? Can you give me an idea what that is? Percentage wise. Are you guys like about 1%, 5%, 10%, 20%?
I would put us at maybe on 20.
And is that after you're taking your paycheck?
Yeah.
Okay, cool. So that profit's there to support. What do you do with the profit in the business? Marketing?
Some marketing. A lot of my patients actually are from referrals from other patients. That's usually where we get most of that. We do SEO, we do some social media marketing as well. Word of mouth has been huge as people get used to this concept and they just fall in love with it, and then it just kind of turns into
Because
a
they can
snowball
budget
effect.
for it, right? It's not this spike in things, and then everybody's trying to save that last pinch, that last penny, or
Right.
whatever. Okay, so if you're a primary care physician, you just graduated or whatever it is that you guys go through, and you're like, okay, do I work for a hospital or whatever? Are you going to make the same or more than if you were to go into a hospital situation or some other situation?
Initially, it's going to be a build-up phase, right? So it's not going to be anything probably close to like hospital.
How long is the build-up phase?
It varies. So my wife probably took 2 years to get to hers. I walked in with over 200 patients when I transitioned from insurance to DPC because I had a following. I had a previous panel of about 4,000 patients in the insurance world.
Only 200 of them came over?
More than that.
Okay.
But that's like from day one opening. And then, of course, as people realize the way I went, they all sooner or later followed.
But there's
A
also
lot of
the
them
sales job, right? That if you're paying for an insurance premium, why would they start paying another $120 a month in addition to their insurance?
Because they're actually using the services and get charged a copay and stuff like that is what I'm thinking. So are they ultimately saving money by coming to you?
So there's still deductibles, right? If you have insurance that you have to pay, and those can be pretty high. The thing that people love is just access. With us going DPC in the healthcare world where you're taking insurance, you're incentivized by volume. So I'm going to bring you in for everything I can because I need to cover my overhead. I want to get paid. I want to get reimbursed. So in this model, if you have a UTI, you just text me. Like, I think I have a UTI. I mean, you know what a UTI feels like, right? So
I'm very lucky that I don't, but like, I know what it is.
Yeah.
So yay for me and my health.
Howie, do you know what that's like?
I know what the acronym stands for, but I was going to use a different acronym, HSA. I think I know the answer to this question, but do you have a lot of people paying you from their health savings account?
We do have people paying us from
that's
that.
cool.
That's
You
great
do
because
that.
some companies, my husband's company gives him like $90 a month
it kind
toward
of-
his HSA.
It varies from HSA to HSA depending on which plan it is. Sometimes they'll push back on it. Sometimes they won't, but we have a lot of them that use that to pay for our membership. And then they also get, wholesale pricing for blood work. So I can run an annual physical blood panel for about $25 cash. And they'll use their HSAs for those too.
So
How do you scale this to make more money?
So you could do it a couple ways. One is, of course, volume. I can see more patients, but I like the place I'm at now with my volume and my work-life balance. It's completely different than what it used to be. I have now more time to take care of myself. I can take my kids to school. I can pick them up and still take care of patients the way they're supposed to be taken care of.
How else can you scale?
We're actually in the process of trying to add another doc at this point.
Okay.
So I have 2 or 3 interested right now that are looking to come on board.
So I
hear you
have a
say-
question.
Oh, yeah, go ahead.
I'm going to interrupt you two in your
Yeah.
interrogation, and I'm going to jump in. Brooke's going to be proud of me listening to this.
She usually is.
Yeah. So I get the ways to scale, but right now you're in little kid mode, which I understand fully because, you don't go take Bali vacations when you've got 3 and 6-year-olds because they kind of suck to travel with. I love them, but they do. So it's like grind, hustle, in it mode. But like big picture view, where do you and your wife see this going?
She's very happy where she's at, in terms of scaling. Her clinic's a couple blocks from our house. She can walk to work every morning. I mean, it's like her dream. So, and it's fine. It's a profitable business for her as well. I've always been more business oriented, so I'm more into the idea of scaling and finding other ventures. I purchased my own clinic space. We own her clinic space as well. I sublease the extra rooms to a urologist, a nutritionist, and we have somebody else coming in, which then more than covers my payments on the property as well.
So tell me a little bit more about that, because one of the things we talked about in the pre-podcast Zoom was doctors coming out of medical school wanting to be doctors, not business owners. Yep. So where did you get that knowledge? Where did you get your education around the business side, or did you always have that?
Research. And learn as you go a little bit, trying to figure it out that way. And some people just, I want to learn about business. I love that part of it. And there's plenty of docs who are just like, I just want to be a doctor. I just want to show up, do my thing, and that's it. But that was kind of never me. I was always wanting to do some sort of business MBA, looking into that. And a lot of the schools now offer getting an MD/DO with an MBA as well combined.
Do you see yourself as ever being an owner of clinics and managing them versus being a practicing doctor?
I still want to practice medicine.
Yeah.
It's something I enjoy. I especially like taking care of diabetics. It's one of my passions. So I think there's always going to be some, in-office clinical work for me. Previously, I think we had in the insurance component, when I owned San Antonio Medical Associates, we had 2 locations, and we probably had 5 docs, 2 or 3 NPs that we managed as well.
Yeah.
So-
I didn't hear you say, by the way, excuse me just one second. I didn't hear you say PAs. I know in the regular insurance medical practice, there's a lot of doctors that want to kind of push you off to your PA.
Mm-hmm.
Do you guys do that in your practice as well, or is it everybody comes and sees a doctor?
If you sign up with me, you see me.
Okay.
Yep. That's how it works. Could we add mid-levels like NPPAs and probably have more profit? Yeah. But I don't necessarily want to do that. One of the biggest complaints that we always had was from patients that say, I never get to see my doctor. I'm always seeing the PA or the NP. So,
See, I grew up a nurse's kid, and so I'm like, yeah, give me the NP.
right.
Like, I love it, but
I think that as a business model, if you're recruiting fairly new doctors that want to practice medicine without the pressure of having to cycle so many people, so the pressure's not really here. So that's an attractive quality. And, with these millennials and Gen Xers or Gen Zers or whatever the latest thing is, they're more culturally driven. They want to see value in what they're doing, that this could be an attractive thing for them to do, and you could pay them less, I would think. So you can still get that profit margin you're looking for and have them see their doctor, and everybody wins because everybody's having a good time.
Right.
So with respect to the scaling, how are you going to approach recruiting, do you think?
So you can go at a couple ways, right? You could just pay them a flat salary. One aspect that we're pushing is that as you're growing your DPC practice, then you're probably going to have some other side gig, whether that's at an urgent care or doing some sort of, VA medical exams, things like that, to kind of bolster your income so that way you can still pay for your student loans and so on.
Why not just provide them with the people? In other words, you hire a really good doctor, right? And you give them 80% of your book, your business, and you continue to build on what you've got. In other words, don't make them actually go out and work the business. Let them just be the doctor that they want to be. You provide them with the clientele, but they're making less profit.
Right.
Your job is to generate the patients.
It would depend on how quickly you're ramping up, right, and getting that patient volume in. So, and that's going to take some time.
Well, and if you enjoy that part of the job, which maybe you won't, maybe you like to just see your patients, but if you have a business development
Correct.
is actually bringing in those new patients and providing to the doctor, to me, that's how I would structure it, because that way the doctor can just focus on being the doctor rather than having to recruit patients.
Yep.
You know what I mean?
so
Go ahead.
I've got a question. And you're super highly educated. Obviously, you're a doctor and board certified and all of that. But on the business side, you're pretty well self-educated, research, figuring it out. So what was the most valuable bit of information that helped you move your business forward? Because you've now built and exited a successful insurance practice, and you're in the process of building location, basically 3 of DCP kind of ish.
In our umbrella company, SADPC, we have 3 locations currently.
Yeah. So you're there. You've had a lot of business experience. What moved you forward the most, information wise or experience wise?
That's a good.
Is it FFA? Fuck around, figure it out?
No, well, I was going
I
to
would
use a
freaking
different
hope
F word.
not.
I was going to use a different F word. I mean, have you had any failures?
Have we had failures?
Hopefully not too many. He's a doctor.
Well, and hopefully
No.
and I'm not talking about a failure in treatment. I'm talking about, you bought a clinic, you got under contract, it didn't make money, you pivoted, something that you invested in, piece of equipment that you ended up not using that cost you $100,000, things
the
like that.
expensive
So,
lessons.
So, right, we stay
That's
away.
how a lot of entrepreneurs
The-
learn, is by failing.
The idea is to keep overhead low in DPC, right? So we're not going to go and buy a $500,000 laser or something like that. It just doesn't make sense. And everybody's doing lasers left, right, and center right now. So, you're going to have to spend even more money on marketing and trying to stand out. So we just know what our path is, and we're just going to stick to it the way it's going right now. The patients are still coming in.
Yeah.
So they're
Consistency. It
just
sounds like consistency.
coasting. And the thing is, if you take care of your patients and you spend time with them and you listen to them, that's so important and that's so powerful.
Well, yeah, because you can't find customer service with physicians these days.
It's
hard to
it's-
find.
It's in and out. You get 10 minutes, you get one problem. Otherwise, make another
And
appointment.
they're not listening anyway. They're not really listening to you. They're already presupposing what the deal is. They're not listening to what the patient is saying.
Mm-hmm.
It just
Well, they also have to keep notes and record stuff and document
do that.
everything. No, they do. They do
Doctors?
because
Very well.
they have to submit it to the insurance company or to the hospital that owns them.
So you have to hit certain criteria to get paid a certain level in
See,
the
they're
insurance world.
they're listening to respond, or they're listening for certain things. They're not listening to listen.
Well, one of the things I like that you talked about, Dr. Vogt, is that even though business school might teach you that the purpose of your business is to maximize profit for the stockholders, you're taking a different approach. You are practicing medicine. You want to practice it in a way that your patients would like for you to deliver that service, meaning spend time with them, listen to them, coach them, and then you're also making a good living, and you're grateful for that. And you're not necessarily always in growth mode, expand or whatever. But when you are, it's not at the expense of the client or the patient, because you're buying the building, you're subleasing. So you're finding other ways to bolster, to use your words, bolster your revenue without taxing that or putting that on your clients, which is very different than a lot of business owners where they're just looking to get more money out of the pockets of their clients.
Yeah, very well said.
So speaking of getting more money, though. So obviously
get
this
paid.
week the healthcare and health insurance industry has been a massive topic of conversation across the U.S. because of a certain incident.
What happened?
The guy got
I'm just kidding.
assassinated.
Yeah, what happened?
I don't know. I think CIA had something to do
And-
with it. I'm just saying. No, I'm kidding.
Oh,
I
conspiracy
don't know if
theory.
he was
That's
that
on the
big.
next show.
Well, yeah, this is not the conspiracy theory show, but
Not yet.
like your clinics are actually uniquely positioned to benefit from all of the positive hype that has come from this, or anti-healthcare insurance hype that has come from it. Are you guys doing anything to capture that? Or is that way
because
too...
you're right. And from a marketing perspective, that would be great to
I feel kind of
subtly
icky,
sneak
but
that
also
in.
like it's an opportunity.
It is an
so-
opportunity. You have to be careful on
You
how
gotta
you
spin
kind
that
of
right.
spin it, right, for sure. Have we done anything specific? No, not at this point yet.
Are there plans?
Well,
Are
this
we
is a time to kick the
brainstorming?
big insurance companies while they're down, and then not to mention, the CEO getting murdered, but definitely talk about the advantages of coming to a, direct pay clinic and how, why you created this is not only to provide a better service, but it's also because we know that some of these big insurance companies are, milking, their clients and the government for money, and you're inherently against that, business practice.
Yeah, it's a big broken model in my opinion. So I like the unique approach that you're doing.
It's a big broken model, but it's big money. And when there's big money, it's very hard to turn that
It's
ship.
a lot of money. I mean, United, it all falls under United, Optum. They own clinics. They own I'm surprised it's not a monopoly, or considered a monopoly. As much as they owe and as much as they can control of the process, it's quite interesting.
Well, it's probably because of the money they spend in Congress.
Yeah.
What? Pay to play. It's not a conspiracy. I think that's fact.
The what is it? The title of this episode: Conspiracy ? No, this is not talking about conspiracy theories. It's talking about business, the business of conspiracy theories. All right, back on track.
Yes.
So, what is like one thing that you wish people knew about your clinic, about your business model that you find is a common misconception?
That sometimes they'll group us into concierge. So concierge, we develop direct primary care or DPC to be affordable. And some of the concierge clinics will charge thousands and thousands of dollars. Plus, they'll still bill insurance. So a good example of that is like MDVIP. Most of their doctors are all still 1099 and functioning and doing their own clinic. MDVIP offers, I think, some marketing to help them build up, but they're still billing insurance and paying a yearly fee on top of that. So we don't bill insurance at all. So when my patients walk in, there's no copay, there's no deductible.
See, I'm glad you said that, Doc, because I was thinking it's concierge. I just hadn't used the word yet.
Right.
I didn't even know what concierge was.
Oh, yeah.
He said there was no copay and no insurance.
No, but it doesn't matter. There's concierge doctors where there's no copay or whatever. But like Dr. Vogt is saying, you pay $2,000, $3,000, $4,000, $5,000 a year to be a member of that clinic.
So, well, that's the thing is the U.S. healthcare system tends to be very reactive. It's like, ouch, it hurts. Go to
it's
doctor.
more expensive, and the vision with DPC was just to make it more affordable because we believe that people should have health care.
Is there any difference in the services between concierge and what you guys do?
It varies by clinic to clinic. Some can offer other services.
Such as?
I think some of them will do like IV drip therapies, little extra things like that. Some might.
I know
have
some of them. I know
machine
one of
in-house.
them that offers a vitamin regimen, but I don't know if it costs extra on top of you being a concierge. But it's like 20 or 30 vitamins a day. They put you on this thing. They test your blood multiple times a year. It's like the doctor says, it's by clinic. It depends on what your business model is and what you're offering.
And you're doing vitamin B shots, right? Vitamin B12 kind of a thing?
B12, yeah.
B complex, B12,
Yeah.
both of them? Is methylated?
We use cyanocobalamin, so it's B12.
Okay, but it's not methylated.
Who should
I'd
be
have to look at
taking
it.
those and
You might want to
what
look
are they
into
for?
that. Use methylated is like everybody can use methylated, but not everybody can take the non-methylated version of it, at least as far as utilization in the body.
We have patients who had like gastric bypass, things like that, who have malabsorption. And then some people just are B12 deficient. Some people just come in every now and then to get one just for some energy boost.
Okay, good. So tell me a little bit more about your love of treating patients with diabetes, because, I mean, this is the right town for it. So
it's just very satisfying to see somebody improve their sugars, and especially with the new medications, which is Mounjaro, which is Zepbound, or tirzepatide, or Ozempic, which is semaglutide, or Wegovy for weight loss. We've seen huge responses, and I've probably taken 5, 6, 7 people off insulin completely with these new medications.
Fantastic.
Because of the weight loss. A lot of the new technology, like with the continuous glucose monitors, the CGMs, they're now coming out over-the-counter versions as well, where you don't need a prescription. But those are fantastic. If you have a new diagnosed diabetic, let's say their 3-month sugar average, which is an A1C, comes back at 10. If it's over 6.5, then they're diabetic, if you can confirm it with 2 tests. And then you put a CGM on, you start on Ozempic or something, and then you'll see like week 1, just crazy high sugars, and then all of a sudden you'll really start seeing those flatten out and come down.
See, if you don't have diabetes or no one in your family has ever done it, I feel like you don't really get the scope of how much of a pain in the ass it is. But I got gestational diabetes, and I got a nice little crash course in what it's like, and thank goodness it was temporary, but it sucks, man. I ate like a piece of a Ghirardelli chocolate and all of a sudden my sugars popped up like crazy. It was supposed to be between like 70 to 90, and it was like 150 after a bite of Ghirardelli, and I was like, what is this baby doing to me? But like, you have to check it before and after every meal. I didn't have a continuous monitor, but my fingers hurt. Wow. Like, just from doing that, and it made me respect a lot more like what people with diabetes go through, and now Ozempic is huge in that population, right?
And there's newer medications in the pipeline that are even more powerful than Mounjaro.
And the expense is supposed to go down in the next few years, right?
That's the idea.
Because it's about as expensive as insulin right now, right?
So
it's more expensive than insulin.
It's more expensive, yeah.
For sure.
So then, so you're helping these patients, they're getting them off of insulin. What does that do for the longevity of their life, their remaining life?
So especially Ozempic also has some other indications where they found that it's also kidney protective. It decreases rates of heart attack, stroke in patients. But so there's so many benefits on it, on top of weight loss and then not having to, inject insulin multiple times a day.
That'd be nice. So most of the time, the U.S. healthcare system's reactive. Like, we do not go to the doctor until something is desperately wrong because it's expensive.
Well, that's why you go to the mechanic only when the car's not working.
Well, I do that, but I'm the worst.
You should be doing preventative
I have
maintenance.
a husband, and he should be doing that preventative maintenance on my car. I'm sorry. That is
sexist
a
that she just
firm
said that?
It is, but she's
belief
allowed
I
to
have.
say it.
Yeah.
I would
You
say the
couldn't
same
say
thing
it.
if I had a
You could
wife,
not.
okay?
No,
Anybody
no, you
I am
couldn't.
married to
No, you
would
couldn't.
have to do the preventive maintenance on my car. But that's not what we're talking about. We're talking about human beings.
Right.
So
A lot of the insurances carve out weight loss medications, so they won't cover them, especially the newer ones. So it's pretty interesting that they'd rather wait until somebody's actually sick and diabetic before they'll cover anything.
Well, and that's the thing. If you think about it, like really manipulatively or vindictively, profit margins are probably higher when you wait because things get worse the longer you wait. So do you guys have like a vitamin, a preventative maintenance kind of strategy that you create for your clients? Because I would imagine that decreases the amount of time they spend in your office if they're taking care of themselves and focusing on their health.
Right. So annual physicals, of course, we do those. We have a nutritionist in-house who actually also bills insurance or does cash pay. So I usually bundle a lot of my weight loss plan patients with the nutritionist. So I kind of try to set them up not just with a shot, but for long-term success with knowing what else to do.
Do you know, I was reading a business book, and it was this guy, and he did all these big things, and basically they tracked his activity through a year, and every time he did a big conference, he basically, like, in his steps did the equivalent of running a marathon, but his diet never changed. So he would gain 10 pounds in between conferences, and he would lose like 10 pounds. And this week he did a conference, and he had never, ever, ever met with a nutritionist and had no idea this was happening. And then he went to a nutritionist, and he was like, why do I always feel like crap? And the nutritionist was like, well, you do 8 conferences a year. You're gaining and losing 80 pounds worth of weight in any given year. That's insane. You need to change your diet when you're doing these conferences because you're running around like a crazy person doing a marathon. And it just like clicked in my brain, like as just human beings. I've never met with a nutritionist. You probably have because you're Mark. Once or twice. Mark is very health conscious. But that's the thing, like high performance athletes have nutritionists because they're doing high performance stuff. And like maybe we're not doing it physically, but if we want to be high performance in business, like are we prioritizing our energy and our brain health? Why are nutritionists not more common in business?
Well, why aren't nutritionists, dietitians, why aren't doctors taking more classes on nutrition in med school to teach people about diet? Because
There's
maybe
more of a holistic approach.
Well,
to
no,
it.
let's go back to the conspiracy theory. It's because maybe the pharma, right? Big pharma just wants you to take pills and shots and things like that versus doing things that you can control, like what you buy at the grocery store, what you eat, how you cook, what oils you use, and that kind of stuff.
Greek yogurt. Just eat a ton of Greek yogurt is what I've been learning from ChatGPT. But
Mediterranean diet,
that's
man.
why
Get
I
off
probably
that
need to
sad, that standard American diet and go to the Mediterranean. You'll live to 120.
It's like Dr.
I don't know if I wanna live to
Dean
a-
Ornish.
Okay.
I don't know
Yeah.
if you've heard of him. Look up. It's ornish.com.
Okay. I think I may have seen something on him, maybe even on PBS.
Probably.
Did something on nutrition.
Yeah.
It's incredible about what you eat.
But I love that. And it makes so much more sense to focus on the preventative maintenance of human health.
Well,
so you're not constantly having to go in for emergencies.
Heather, we like to be confused. So let me tell you why. Because we'll read a study or we'll hear a headline that a glass of wine a day is good for you because the people in France, da. So we turn that into, well, if one glass is good, two must be better.
Why not both?
And 3's amazing.
And three's amazing. And then, why not alcohol with that? It's just like wine. It's a kind of a little bit of a different process. And so we like to get confused. Eggs are good one decade, then they're the worst thing ever.
Bacon.
And then back to whatever. And so we let ourselves get confused, but there's no disputing the fact that eating processed food, eating fast food, eating high sugar diets, and all this other stuff is ridiculously bad for us. But we see everybody doing it, and they're still alive.
And I gotta say, a McDonald's double cheeseburger at 1 a.m. after you've been out,
Having a couple of glasses of wine.
delicious.
Are you not from Texas? What about Whataburger?
Whataburger, the
Why
lines are
McDonald's?
too long, man.
All right, so let's go to employers. So you guys work with employers as well
We do.
for group plans, that kind of stuff?
Yep. So that's one reason we set up SADPC, which is San Antonio Direct Primary Care, is to allow employers to sign up their employees, and then the employee can choose which clinic they want to go to. And then if they sign up 5 or more employees, we actually give them a discount. So we actually
That's what I was going to ask for.
we actually have over 200 employees, doctors' offices. We have trash companies. We have the Lawton Group of family restaurants.
Do you guys market that separately, and do you have a page for that on your website, and do you SEO that right there to get doctors to sign up? Company owners to sign up.
So it would be on the SADPC website.
So, how do they structure that? Because, as someone who has given birth twice in the last 2 years, and that just blew my deductible out the water because, Advil's $300. Do employers structure it to where it's like they do their primary care through you, but they also have a high deductible insurance plan where it's just cheaper?
They
For,
can,
emergencies?
They can. So there's a few companies that are like medical cost sharing that have partnered with DPC clinics that actually get an extra discount if they have a DPC doctor. So some of them utilize something like that. One of those companies would be like Sedera. Some use, I think it's called 9 Degree Benefits, which is like a self-funded insurance plan, and they'll piggyback that with direct primary care. So we have, I'm trying to think of who else we would have with them.
But it's cost savings, right? I mean, for the
It
the
is.
employer.
So we ran the numbers for the Lawton Group the other day, and per individual that was signed up, they were saving $770 per year
Nice.
per individual.
How many employees did that company have?
Mm.
Ballpark?
That's hard for me to say because not everybody's signed up.
Okay. Is it like hundreds or is it
Like
30?
They're definitely over 50.
Okay.
Sure. Yeah. Another
So-
example would be like Michelin. So our Michelin-starred restaurant that we have in town. So that's like
We
another
have a
example. of something we have.
Michelin-starred restaurant.
Would you do
Yeah.
smaller companies
saw
like
it on
maybe have 5 employees?
Social media.
We do.
And would
Yeah.
they be looking to save about the same kind of a savings a year?
They potentially can. Yeah.
Is there a reason for them not to do this type of program with direct primary care and then use other catastrophic insurance?
If you have somebody who, has a lot of complex medications,
But as an employer?
as an employer,
As an employer, is there a negative to using you with catastrophic?
not that I can think of. I mean, the employees love it because a lot of them in the service industry. So if you're somebody who's making minimum wage, you don't want to be away from work. So
Wait, anybody's making minimum wage these days?
still happens.
Texas,
Yeah.
$7.25 an hour.
No, I know, but good luck finding a place that
no
can
one's gonna
find
hire you.
employees to pay that. But anyway, what does it look like to get into your clinic? Because that's one of the big complaints about the insurance-based medical practice, right? You call today, hey, I'm not feeling so well. I'm having trouble swallowing or whatever. Can you come in July of 2027? We have an opening. You're like, wait a second. No, I need something now.
Then you go to the Minute Clinic and argue with them about viral respiratory panels.
Right. But most people are not going to do that. So what's the process like, Doc? They call your office. They get on the website. Do you have a little thing that says our wait time right now is 27 minutes, like these ER clinics?
I had a patient message me at 7:51. I saw them at 9:50.
Okay.
Oh, nice.
So there's not really a wait time. They can pretty much get same day access.
Yeah.
Yeah, and that's good. Look, I think that's if I'm running a restaurant and I hear about this, I just need to be able to understand it very, very quickly that it's
Right.
going to be saving me money. It's going to be better for my employees, and it's not this big
You're not gonna
mess
be
that I'm
short
So let me
getting
tell
involved
you,
in.
I have a client that owns some car repair shops, and they own a tire and wheel place. And when they're busy, they need all their people working. So he hires a company to come and give flu shots. When COVID shots were, he hired somebody to come and do it there. Because these are people that would normally not go to a doctor, his employees. But he needs to keep them well, because if they're sick, he doesn't care that he doesn't have to pay them if they're 1099. He's not paying them if they're not there, but he needs them there because the opportunity cost of them not working costs him money.
That's a different model, though. That's like mobile medic or something.
Yeah, but why wouldn't Dr. Vogt market to people like that? There might be some kind of hybrid. You talk about scaling. If you can send somebody out to go give all the flu shots to 30, 40 people out there, and they're still part of the membership, right? Even if they're never going to go down to the office, but you're providing some of that.
Would
And
you
That's a
guys
good
do that?
like NP role.
Well, you can just have a medical assistant go out and give those shots. That's
Yeah,
easy
just
enough.
a-
We use a third-party company called VaxCare for our vaccines. So it's either cash, or if you want to use your insurance, you can use your insurance, and it'll tell me if it's free to give in my office. Then we can just give them in the office.
yeah, but think about it, man. You need a swab, you need whatever and the last thing you want is somebody with strep throat there and then giving it to 10 other employees.
Yep. And what we do is I'll just tell the person, hey, park in the parking lot. My medical assistant will run out real quick, swab them.
Yeah, great. So I'm going to ask this for a friend. I have a friend who runs a runs a podcast, and he likes cold plunging. Okay.
Okay.
And so we've compared notes on cold plunging.
55 doesn't work, by the way. There's a big difference between 55 and 50.
There you go, pointing and looking at me again.
Yeah, because you do 55, I'm just
Yeah,
saying.
but I'm in 55-degree water for 15, 20
Doesn't
minutes.
matter.
You're in 38-degree water for 3 minutes, and then you go take a hot shower.
Do you know anything about cold plunging?
I know.
Let's just start with his qualifications.
Which is better,
first.
Frank?
I know it's.
But did
it's
you
a-
take a cold plunge class in college?
I know it's a thing right now.
It's taught by Joe Rogan.
It is.
Yeah.
Good or not good?
I haven't done it. I'll tell you though, after like a long run, I'll go take an ice cold shower to try to reduce the inflammation.
But in San Antonio, ice cold shower is really like 75.
You're right. Yeah, exactly.
In the summer, yes.
You can't get it any
Yeah.
colder. It's weird. No, but
Yeah.
I think it's got some benefits.
Okay.
Yeah.
I like
You-
anti-inflammatory benefits.
Anti-inflammatory, yeah.
Is it something that it stimulates your cells to do anything cool, like heal anything or wake up?
He just said
I've
he
got
didn't
another
study in
question about
college.
something
That doesn't
different, but
matter, but he
along
knows
the same
about
lines.
cells.
So answer that, and then I want to ask my question.
Okay.
So right, the cold is reducing the inflammation. So that's where you're getting the benefits from.
Okay.
My question is about NeuroGum. The NeuroGum.
Yes, that is a
Has
thing
anybody
now.
tried it? I have not shelled out the $30 to buy it, but like Joe
gonna.
Rogan swears by it. What
Really?
are your thoughts on that?
I haven't even
Joe
heard of
Rogan's
it.
doing it. It must work.
Oh, here we go, Joe. You guys.
I'll have to look
just
up.
had to
You
get
have a
his
bunch
name.
of
I haven't even heard of
followers,
it.
I saw
man.
it
You
on
have a bunch
Shark
of
Tank, and all
followers.
the sharks rejected it. But then Joe Rogan started talking about it on his podcast, and they went bonkers. This company went from $1 million valuation to like 20 plus something. But it's got like, what's that?
It's got
Vitamin
caffeine in it.
It's got caffeine, but it's got something else in it that's supposed to sharpen your brain focus.
Ginkgo?
I don't know.
And it's $30 for a
I'll-
pack of
For
gum.
a pack, yeah.
I'll put it on my list.
How many?
Yeah,
Is
I
it
think you
3
eat 'em
sticks?
2 at a time.
No, like, yeah. Between
gonna
that
try
and the
it.
smelling
I am.
salts, it's like
Just
weird.
just chew a handful of Altoids. It'll do the same thing. You're
What?
Like, oh shit! Wide awake.
Nootropic gum. That is
Like they need-
nootropics.
like
nootropics.
I've heard that
Yeah.
term, nootropics.
It's got B6 and B12, and then something else. I don't know. But you do get a free gift with purchase.
Sure, for $30.
Yeah, $24.99. Sorry, not
Oh,
$30.
$24.99.
Yeah.
What a bargain!
Discount,
So give
you
me
know?
2 packs.
Ooh, they've got cinnamon. Nice. I'm trying to see what the exact thing is in it, but we can talk about that probably offline so people don't just like
All right,
sit
Doc.
there.
So let's talk about other ways that you're building out your business. Is there anything we haven't covered yet in how you're approaching growing the business? Because you're still in growth phase.
For sure. What's important to me is that I find the right person, and that's really key. I need somebody who has kind of that DPC mindset, who's there for patients, and that I get along with. They're going to be, sharing space in our office, so that's the most important thing.
Culture.
Yeah.
So same culture. Yeah, but we've talked a lot about that here in the show. Sometimes it's more important to hire the person who is the right cultural fit versus the person who might be best equipped to do the job. Because you can train that, you just can't train the right culture.
Right.
So what are DPC's values? Their core values?
Patient care is number one. That's always going to be an access. We want patients to have access to get a hold of us.
Patient care, not patient improvement.
All of it.
Think so?
Yeah. My visit slots are between 30 minutes to an hour, so I can actually sit down with patients and get into nitty-gritty details and comb through stuff and really hone in on things. And that's what I love about this practice.
Have you fired any patients?
I haven't fired any patients. I mean, there were some where it just wasn't a mutual good fit, which still happens.
So they stopped coming?
Well, they have to end their membership.
Right.
Or
Do they pay monthly or is there a contract?
It's month to month, but we encourage them to stay on because you are building a long-term relationship with your primary care doctor, your family doctor. That's the idea.
Yeah.
It's
So
the
they're
same tactics I use for my virtual assistants. It's month to month, but we're building a long-term relationship.
Well, no, but it does make sense in a lot of industries because if somebody is just going to activate their membership every time they come to you, are you going to flag them and say, well, that's not how this works?
And has that happened?
It has not happened.
Well, he's got $100 startup fee, so you got to pay a startup fee and then be paying your membership,
That's
right?
not a whole lot of money.
And I
It's not.
Especially nowadays, it's 2 cups of coffee and a sandwich.
It's a lunch
for
and a
tip,
sandwich.
you know?
3 packs of gum.
3
Yeah,
packs of
three.
Neuro gum, yeah.
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 All right. So people are coming to you for basic care, right? They're not coming to you for trauma,
Right.
correct? Anything else that you're not, that like maybe somebody would think that you guys would do that you say, we don't do that? Like you said, testosterone shots, you'll do those?
If they're appropriate. I've seen a lot of inappropriate prescribing of testosterone coming through a lot of these low T clinics, places like that.
Meaning they're
So,
trying to do steroids
Well,
without
that's
doing
their
steroids?
business model. That's what they're promoting all the time. I see that.
patients coming in with like super therapeutic levels of like over 2,000 and things like that, which
And they want
you
more?
should not be there. Huh?
And they want more testosterone or what?
Well, then you have to break it to them slowly that you're going to lower their dose because they're, way too high.
Yeah, they've got a lot of testosterone.
But you're not doing IV drips for folks, right?
No.
How come?
One, there's an IV shortage. So, right, the hospitals kind of need those more than the IV clinics that are kind of poking around.
Well,
Yeah,
like
I just found out about that there's an IV shortage, not just from the news, but we do all the marketing for Frio Regional Hospital, and they had a several month supply because they needed it for their surgeries. But there's other hospitals and other clinics that just don't have it.
Yeah.
How hard can IVs be to make?
No, there was
If there's a
something with
limited amount of companies
yeah,
that
and there was a
make it,
plant that went down. There was a problem with one of the plants, got hit by some tornado or something, and yeah, they did cause a shortage very quickly, and it was going to take months to ramp back up.
yeah.
Okay. Interesting. Well, I know Restore down in the quarry, they do IV drips
They'll do
there
it.
as part of it, and they do
Yeah.
the B12, B complex shots.
Go
as
back
well.
and be like, there's a shortage. No.
There's
It's not
also
that. I'd
there's also
rather
more
go with-
liability that
Yeah.
goes along with it, right?
Okay.
So one, you have to have somebody who's good at IVs. You make sure that patients are properly screened because you also don't want to give IV to somebody who's got heart failure. So and then you have to run that by your malpractice carrier.
They do that once a year, though. That's not, I mean, that's what they do.
Who?
Like Restore, for example, that place I'm talking about.
Right.
You just have the meeting with the PA once a year over Zoom,
Mm-hmm.
right? It's not overly complicated, and then they can do the IVs, right? You got people coming in and out doing that. You probably don't. I'm guessing that you would have to charge put a surcharge on something like that if it's going to be almost recreational use kind of a
Right.
thing. You're coming in just to whatever, because the cost would get kind of ridiculous too. Is that a reason maybe why you're not doing that?
No, I mean it's. I'll tell you, it's cheap, and IV's a couple bucks.
Because if you were doing methylated B shots, B12, B complex, I could get the membership there, and I would save money coming to you to do that. I just can't. My body won't utilize the non-methylated version of it. But I mean, I'd spend $120 a shot. The other place, well, close to it, probably $100, and that's once a week.
Yeah.
And that's kind of the limit on getting the B12 shots is once a week. Do you have people coming in once a week to do that?
Most commonly, it's for me. I have every other week.
Okay.
Yeah.
That's not even too bad. I usually get cranky if I go longer than 2 weeks, but it's interesting how it supports mood.
Right.
B12 does. And it's vitamin D as well.
Correct.
Do you do vitamin D shots over there?
No.
You need to expand.
Mark's like, I need you to expand so I can switch.
Right. I mean, because you could compete. You could have different levels of membership, right? Do you already?
No, we just keep it simple.
I was
Unless,
going to
yeah.
give you crap about that.
I know, but here's the thing, man. He's got his niche.
I like it. I
And
honestly
he's-
like it. He's
yeah.
dialed in.
Yeah, he's dialed
Whatever.
in, and that's
Mark
good.
wants people to expand to a cheesecake style or cheesecake factory style menu.
Not that bad.
I like the more
Cheesecake
dialed in style.
Yeah.
But look, people need vitamin D and they need vitamin B. And they don't even realize that they're deficient. And shots are a great way to do it rather than popping the pills every day. And you're not getting the full utilization of the pills anyway. Shots are a better way to do it, at least in my experience and opinion. So that's what I think. I think it would be
I
great.
feel like it would be more than
Two-tier
$120 a month, though. Because if your shot's costing however much and you do it once a week, that's the max. You have to factor that in. So
Yeah.
it'd probably be more
Different
like,
level membership.
yeah.
Yeah. But I think it's a great service. I think it's
But it's also a
needed.
different business model. Then he's going to be known for giving these shots, and he's going to put that on his website. Then Google's going to start indexing him for that, and then people are now going to call to become members of his
DPC.
primary care practice.
So
See, I
this is
didn't
more
call
of
it
a Howie
concierge. I
question,
wanted to, but-
So how do you have like SEO optimization going on for your?
We do.
And is it high level good company that's?
For my personal one, we use I use somebody who's well versed in DPC.
Oh, okay.
Yeah.
For optimization.
Yeah.
That's smart. And is it paying off?
Yeah. I haven't.
You just have to
Same
look at
thing,
the
yeah.
analytics and see if you're getting uniques and those
Yeah.
kinds of things.
Do you look at the analytics?
I usually have them run it a couple times a month.
Okay.
Yeah.
And
And then
numbers
I'll
good?
get feedback from it as well.
What do people search for when they look for you? Primary care physician, or do they look for something else?
Doctor, no insurance.
You could look up just look up San Antonio Direct Primary Care.
Yeah, but what are people actually Googling?
Family physician. Some will pop up under concierge that way too.
So, family physician. Do you see children as well, or only adults?
I see starting at 15.
15.
Yeah. Mm.
So, and do they have to be the children of your patients, or even, somebody
They
brings
can be
their
on
kid
their
in?
own.
Well, they probably
Maybe
have to
on
have
their
their
own,
parents
yeah.
buy in on it.
But there's also like pediatric direct primary care now.
That's good.
Yeah, so
How
there's quite a
many
few of those.
direct primary care clinics are there in San Antonio?
They are growing like crazy. If you go to DPC Frontier Mapper, a lot of them will be up there, and you can search by zip code.
Okay.
I'd probably say if you're counting DSC as well, it's got to be at least 20 now.
Okay.
Yeah.
Good. Well, I would ask you, how do you stand out? But we don't have time. We're actually out of time. We're at an hour and 6 minutes. Not bad. All right, Doc, if folks want to get in touch with you, how do they do that?
Yeah, just go to www.sadpc.com, and then you can see all our clinics on there and our pricing structure as well.
All right, love it. Well, great information. I think we came at you with a lot of different questions and some of our own ideas, which often happens in the show.
The brainstorming
Right back at
session.
myself. All right, thanks for coming in, Doc. I appreciate that. As we wrap up the show, quick reminder, check out our latest podcast. Catch video versions of the show anytime by visiting our website at satalkradio.com. That's going to be it for this one. You guys have a great week. We'll see you on the next one.
Thank you.